Welcome back. I'm Brent Meredith, and if you're just joining us, I'm talking with Ray Zimmerman, Director of the VUMC Program for LGBTQ Health and Office for Diversity Affairs, about the recent resurgence of monkeypox. Welcome back, Ray. We've got more questions, of course.
Thank you.
So we talked about in the first segment about contacting and tracing and knowing and whatnot. Prevention is what I want to talk about now. There is the vaccine, you mentioned.
Yes.
Is the vaccine safe? I think I know the answer to that. And I understand it's been around for quite some time, right, as it's related to smallpox, or it's a portion of that type of vaccine. But tell us a little bit about how it got started and sort of the safety behind it.
Yeah, the vaccine is relatively safe. I actually don't know. I can't recall when this particular vaccine is developed, but we know that it is very effective.
Sure.
For monkeypox. As far as it's safe, absolutely. I think for folks who have a history of keloid scarring, you want to let your provider know that when getting the vaccine, because there are a couple of different ways that the vaccine can be administered. We're actually administering more intradermally because we can actually, that requires less of the vaccine, and so that extends the supply that we have available. But for folks who have some keloid scarring, they need to get it subcutaneously. The vaccine will leave a red mark that's probably about the size between like a quarter, $half. That will go away.
But that's normal.
Yeah, that is absolutely normal. It may itch, and it will go away on its own within about a month.
Now, I know there are certain criteria because there's not an overabundance of the vaccine. There are certain criteria that one needs to meet, at least right now as we're talking. That may change by the time we air. But what are some of those criteria? Obviously, our community is pretty high on the list of availability.
It indeed is, because we're seeing more transmission among folks in our community. So the recommendations are that men who have sex with men, transgender folks, and non-binary folks receive the vaccine, particularly those who have had multiple sex partners within a 14-day period, have had anonymous sex, for folks who actively have HIV, or for folks who are on PrEP to prevent HIV. All of those folks are indicated to receive the vaccine, and vaccines are available largely through every single health department in the state of Tennessee.
Well, and I'm glad you mentioned that. Was going to be my follow-up to that. Was I know that the Lens Clinic here in Davidson County is providing them, and I was curious if they were provided in other health departments across the state.
They are. From my last conversations with our health team, that they are available in every county in the state right now.
Fantastic. And I also saw that there's been some talk about, some places doing maybe drives for it or outreach, letting them know. But I think it's important what you mentioned. It's safe to have, even if you have some of these other underlying conditions, if you are HIV positive, if you have other things. So there's no reason for anybody to be sort of reluctant to get it, right? If they have another sickness or if they're between COVID shots or anything like that.
Right. Yes. You mentioned the COVID vaccine. There are some contraindications with the COVID shots as well. So if you get there are two shots for monkeypox that are taken 28 days apart. And if you get the monkeypox vaccine first, but then you qualify for a COVID booster as well, you really need to wait another 28 days before you get that COVID booster, because we've seen some issues, particularly in younger men, that indicate that we need to wait, right? But now if you get the COVID vaccine first, then you're actually fine to go ahead and get the monkeypox vaccine as well. I also want to mention that there are no known contraindications between the monkeypox vaccine and the flu vaccine, which we're in flu season as well, and so you can go ahead and get the flu shot anytime.
Well, and thank you for clarifying that, because it has gotten to the point now where you're like having to manage your vaccines, right? So I mean, it's important to know what to get and when. One of the things I wanted to touch on, sort of the last question I wanted to ask you, was a little bit less technical and a little bit more just sort of philosophical. We've seen some gay blaming. We see it for a lot of things, but we've seen some gay shaming and gay blaming around monkeypox. It's ridiculous, you know. I mean, there's nobody's to blame for anything. Things happen and you deal with them.
Yeah.
But I was curious, sort of from where you sit, what is your sort of response to that? Should people should not feel ashamed, first of all, to get the vaccine or to ask for help ever. But what does that do for just the general public when stuff like that happens?
Yeah. Well, I think in this instance, we know that anybody can get monkeypox.
Sure.
And so, my concern is that cisgender heterosexual folks might be asleep at the wheel right now and think that this doesn't affect them, right?
Exactly.
Because we are seeing heightened interest in getting our community vaccinated, and I'm so grateful for that. However, anybody can get monkeypox, and we all need to be hyper vigilant about this as well. And I think stigma really hurts our community. We see this time and time again, and what I know for sure is that people tend to delay care because of stigma, right? And so folks may not be seeking help in a timely manner, and they absolutely should be. I will say, even with the criteria, in having to attest, you may have had multiple sex partners, and there's nobody at the health department that's going to make folks feel ashamed for the criteria that's there. That's actually where I got my vaccine, and those folks were great, very professional, and made the experience really tremendous.
They just want vaccines in arms, right?
Yes, it was so easy.
Shaming anyone hurts everyone, right?
Absolutely.
I mean, it just does. And listen, thank you so much. I hate that we're out of time. I've enjoyed talking with you, and thank you so much for providing these answers. I know a lot of these questions I've heard from others, so I'm glad that you were here to give them a better answer than what I could.
Well, Brent, thank you so much. Public information about health concerns is really important, so I just really appreciate the opportunity.
Thank you, Delray.
Thank you.
Thank you so much. And after the break, we'll be right back with Tennessee Equality Project Executive Director Chris Sanders to discuss the upcoming midterm election. You'll want to see this one. Stay with us.